International Health Mastery. I am Dr. Fehmida Iyer Visnagarwala. Chapter 1. Brief History of Global Health. Even though this course has been termed International Health, emerging data and concepts favor the term global health. For instance, it talks about the health of population in a global context, not confined to nations, an area of study and research and practice where the issues transcend national boundaries and that which require cooperative action. It places priority on improving health and achieving equity in all health for people. Why study about international global health? There are a lot of unfinished and emerging agenda. Did you know that these are some of the staggering statistics which compel you to look at global health? 1.5 million AIDS deaths, 1.5 million TB deaths, 289,000 maternal deaths, 584,000 malaria deaths, over 17,000 under 5 child deaths each day, 1.3 million cardiovascular deaths in low-income countries, more than 1 billion people living with soil-transmitted helminthic infections. These are the staggering data. Over the last decade, health researchers and funders have become increasingly concerned with the 10-90 gap. This is a phenomenon that only 10% of health-related research addresses problems of 90% of the world's population. This inequality is of special concern to social epidemiology, given the implication that the vast majority of research applies to the wealthiest and healthiest nations, with the vast health disparities occurring in the remaining 90% of the global population. So let's reflect on a brief history to understand how we have come to this juncture and how to go forward. Ancient Ayurvedic systems and Chinese systems of medicine. The Ayurvedic system of medicine in India is one of the oldest systems of medicine practiced since more than 4000 BC. The knowledge was said to be transmitted from the sages to the physicians. The greatest and complete compilation of Ayurvedic work are in Sushruta Samhita and Charaka Samhita. The Ayurveda therapies have evolved over millennia despite the invasion and the colonial rule. The medical system has all sorts of treatment with herbs, metals and minerals, and even surgery, as seen here, surgery being performed by Sushruta. Today, the WHO recognizes Ayurveda as a traditional alternative therapy, and many communities in India and the West survive on Ayurveda therapies for health maintenance. It focuses on keeping the three dosas, Vata, Pitta, Kapha, in balance. This is the main tenet in Ayurvedic medicine. Similarly, traditional Chinese medicine has been practiced for over 2,500 years and includes various forms of herbal medicine, acupuncture, exercise, and diet therapy. The movement and balance of qi in the body through various meridians is the mainstay of the traditional Chinese medicine. The concept of yin and yang is applied to the body and its relation to the environment. The history of public health in the Western literature has been traced to Hippocrates. His book, Airs, Waters, and Places, was the first systematic effort to present causal relationships between environment and disease, and for an understanding of endemic versus epidemic diseases. The Romans in the 1st century AD introduced public sanitation and water supply, which is considered by many as the origin of public health. While the spread of bubonic plague, or the Black Death, was the greatest pandemic of the 14th century, where 25 million people were killed in Europe alone. This map shows that the plague came from Central Asia and traversed in the trade routes of Europe and then spread inland. The classic concept of today's quarantine was introduced then, where the sick and healthy were separated, especially at the ports during the Black Death. The colonial expansion happened over the 18th and 19th century, which are considered as the Middle Ages. The Europeans gave diseases such as influenza, measles, smallpox, and chickenpox to the indigenous populations. For instance, there are reports of smallpox-infested blankets distributed to the Native Americans in Americas, which wiped off whole tribes. Thus, the germs were an important biological weapon used by the Europeans. The travelers brought back to Europe diseases such as malaria and sleeping sickness. Eurocentrism or Western centrism, due to widespread colonization by the Europeans all over the world, has pervaded almost every aspect of our lives, such as education, politics, judiciary, economy, policies, and healthcare. This has been at the expense of Western philosophies and cultures. For example, the well-developed Indian and Chinese cultures, as we discussed earlier. To understand this phenomenon fully, why this happened, one can find some answers in the book Guns, Germs and Steel, written by Jared Diamond, an anthropologist. I strongly recommend you to read it. The Industrial Revolution in 18th and 19th century led to rapid urbanization and overcrowding, leading to spread of diseases such as TB, typhus, and cholera. The poor were named as dirty party, and the government began to take interest in the lot of the poor mainly because of cholera. Connection was drawn between unsanitary conditions, diseases, and pauperism. John Snow showed how cholera was spread by contaminated water by removing the hand pump handle and stopping the epidemic of cholera in that area. Various public health related legislations were passed in Britain, USA, and mainland Europe. From 1850 to 1910, it was the knowledge about the causes and transmission of communicable diseases which expanded the horizons of public health work and vaccine development. The germ theory of diseases was born, where we were able to identify particular bugs causing specific diseases, leading to development of science including Robert Koch's postulates and Louis Pasteur's work. 1910 to 1945. There were reductions in child mortality with the use of vaccines and better sanitation. Schools of public health, foundations, and intergovernmental agencies interested in public health were established. There was a setback in the healthcare systems due to the World War II from 1939 to 1945. after which the Great Britain's national health system emerged as the most emulated health system. As post-war effort, the United Nations was born in 1945. The UN agencies such as the World Health Organization or WHO was born on April 7th, 1948, along with United Nations Children's Fund or UNICEF and the World Bank. The WHO, along with coordinated efforts with the 190 member countries, was able to eradicate smallpox. UNICEF led the way for universal immunization. September 1978, at Alma-Ata in former USSR, Declaration of Alma-Ata was adopted. The goal was health for all by 2000. Urgent action by governments to improve primary health care was adopted. This led to a rise of primary health care all over the world, especially in countries such as India. It led to the development of a cadre of community health workers known as ASHAs, through which more than two-thirds of a population was reached by India. In the year 2000, the 8 Millennium Development Goals were adopted, which were to be completed by 2015. We will learn about this in another chapter. This is an overview of the history of international health. 400 BC, Hippocrates presents a causal relationship between environment and disease. 1st century AD, Romans introduced a public sanitation and organized a water supply system. 14th century, the Black Death, bubonic plague, leads to quarantine and cordon sanitaire. Colonial expansion spreads infectious disease around the world in Middle Ages. 1750 to 1850, the Industrial Revolution results in extensive health and social improvements in cities in Europe and the United States. 1850 to 1910, knowledge about causes and transmission of communicable diseases is greatly expanded. 1910 to 1945, reductions in child mortality occur. Schools of public health and international foundations and intergovernmental agencies interested in public health are established. 1945 to 1990, the World Bank and other UN agencies are created. WHO eradicates smallpox. The HIV/AIDS pandemic begins. The Alma-Ata Conference gives emphasis to primary health care. UNICEF leads efforts to ensure universal childhood immunization. Greater attention is given to chronic diseases. 1990 to 2000, priority is given to healthcare sector reform, the impact of and responses to globalization, cost effectiveness, and public-private partnership in health. 2000 to 2010, priority is given to equity, social determinants of health and development, use of innovative information and communication technologies, achievement of Millennium Development Goals, and response to influenza. Adapted in 2016 to be achieved by 2030. We're looking forward to have the 17 Sustainable Development Goals, which envisions global health as a living planet where all life on the planet needs to be protected and preserved. Why study global health? There are ethical dimensions, there are impacts on the productivity of individuals and countries. There are links with economic and social development, implications for global security and freedom. People and governments spend a lot of money on health. lack of respect for boundaries. The health of anyone, anywhere, is the health of everyone, everywhere. This is why we should study global health. It is important to recognize that developed nations do not have a monopoly on good ideas. There should be a true two-way partnership, pooling of experience and knowledge between developed and developing nations.